My name is Dr. Githinji, and I'm the Global CEO for AMREF Africa. I do also sit on different areas that intersect with the issue of right to health. So I'm in the board of Africa's CDC, Centers for Disease Control and Prevention, but I'm also involved in the delivery of health, the global partnership on prevention of maternal child health. It's called PMNCH. Again, looking at the right to health and how people access healthcare. The question of right of health is actually a very complex issue. Whereas health is a human right, we have found that it is not a right that has actually received, other than advocacy attention, it has not received economic attention. In the UN Declaration of Human Rights framework, there was a tug of war, of course, between West and East, and the rights framework was divided into two. The West insisted that civil and political rights were supreme and were therefore classified as first-generation rights, whereas social and economic rights, which are also human rights, were delegated to second generation. The reason they were delegated here is they were seen not to be implementable. They were seen to be progressive. They were seen to be left to a country's economic ability. And they were seen to be that this is a recognized right, but as you increase your affordability, as your economy grows, then you can provide more and more towards this right. But civil and political rights were seen to be absolute, that everybody must be able to vote. And if there is somebody stopped from voting, then there is absolute protection for that person to vote. That's not the case with other rights that were classified as second generation. That has seen us result in a situation whereas health is a human right, it is a less protected right than political and civil participation. What that means is that if a woman who is pregnant seeks health care for her and her child and loses the child or loses her life, it is not an implementable right. It is desired, but the country can argue that we are not a place where we can actually provide health as a right to everybody. If a woman needs or a man needs treatment for cancer, the government can say, this is a progressive right and we'll provide it when we can afford it. But if you need a civil right to vote, it is absolute and must be provided immediately. This framework is actually what has complicated health as a human right in the continent of Africa. A good example is looking at COVID-19. When we came up to COVID-19 and everyone had a right to access to available technologies and products for protecting themselves, their families, and the community, and specifically COVID-19 vaccines, we found that it was left to affordability, okay? Whereas high-income countries could afford and access as many as the second and third doses, people in Africa struggled to get their first dose. If you compare that to a country, for example, that denies its citizens the right to vote, the international community would actually be on the ground to ensure that people vote. You have seen countries actually get into war because the government has denied civil and political rights to its people. But you've never seen a country get into war because individuals have been denied health rights. This is the disaster that we have. And the COVID-19 demonstrates very well that the human right to health is left to individuals to claim. So what shall we do? I think that we in Africa must demand that right through social participation, through civil participation, that actually because we do not expect the governments to give it to us willingly, the way they actually give it to us. I'll give you an example that, during elections, the government rolls out resources to ensure there is education on the participation, on the elections, and they roll out awareness every day, everywhere. But you saw that for COVID-19 vaccines, it was almost every person for themselves. If you get the information, but if you don't get it, this is the problem. So the people must start to demand. So we have platforms like civil society participation, individuals demanding, because the individuals, when you talk about the right to health, who is the right holder? The right holder is you and I. It is the individual who holds the right to health. But who is the duty bearer on that? It's the government who the individual votes into power. Therefore, the individuals who are the right holders must create systems that empower people, give agency to people to stand up and demand through their vote, through follow-up and accountability of governments, through their constitution, to demand the right to health as the right holders from the duty bearers. So this must be the social participation that we must educate our people on, but also facilitate, because that requires facilitation. It requires resources to be facilitated. And this is the role of government, actually, to facilitate civil participation to demand for the rights that citizens need to receive. So this is the challenge. And we hope that in our lifetime, we will see health right as a truly participatory and demanded right that's provided to all. The loss of life, which results from a health system failure, should not be concluded by our people in Africa to be the will of God. It is actually a system failure which asks us to ask ourselves, where did the system fail? And what could the duty bearer, who is the government, have done through better regulation, financing, compassionate care, and providing the services that are needed? There's a reason why the life expectancy in Africa is 64 years and the life expectancy in Japan is 87 years. It's because of a failed system that has refused to consider health as a human right, which must be provided under all circumstances by the duty bearer.